Thank you.
Good.
Okay, hi everybody, and thank you for coming today. I'm really pleased you come to our healthcare showcase. This is David. David will introduce himself properly shortly, but he's leading the session today. Obviously, any questions, please do feel free to ask him. And if we can do anything else for you, please let us know. So, David, over to you.
Thank you. Good afternoon. Thanks ever so much for coming to my session. Just realised the camera's at the back there, so I'm going to stay down here so I'm very small in it. But those of you with your laptops at the back, just in case you've got any dodgy websites, there will be caught on the camera. So, this afternoon's session's about helping your students to do well in our assessments when they come for interview to any kind of school of healthcare activity. But with anything, there's no free lunch. So the first thing you're going to get from me is a bit of a sell about the School of Healthcare at the University of Leicester. Then I'm going to talk through why we do selection interviews and why healthcare is different to other courses. You know, you can get a place on, say, history and geography just by submitting a UCAS application, and there's nothing else, and then an invite to the university at a later point. Healthcare, we have a slightly higher bar because we want to meet the people, and I'll talk a bit about that, why we do that. And then we're going to go through the different approaches we use to select and explain to you what we're looking for in each of those. So when you've got a student coming to us for interview, you can say to them, this is how you need to prepare. This is the sort of things you need to be doing. And I've worked at 2 other universities. I'm pretty aware of what goes on elsewhere as well. And the things I'm talking about today are ubiquitous across schools of healthcare in the country. So, you know, it's not just about Leicester. This should help your students with anywhere they go, medicine included, I would have thought. So we'll talk about the School of Healthcare first. And I've been here for just over 2.5 years now. I'm a pharmacist. I came from the University of East Anglia on the promise of being able to set up a unique school of pharmacy or program of pharmacy, which I've now done and starts in September this year. And when I did the talk last year, I wasn't allowed to mention it. It's a bit like Bruno, you weren't allowed to talk about it because we hadn't got permission from the regulator. But the regulator came last week, gave us hell for 2 days, and at the end of it said, you can take pharmacy students, you're fit for purpose. So this September, we will have a small cohort. We only ever take a small cohort in the following year because obviously we've got to get it right, and it's easier to manage with small numbers. So when I came here, I said to the staff, what are we about? What's our vision? And so over the last 1.5 years, we've built our vision. I built it with all the staff in the school. And this is what I think is what we want to be about. We want to produce high quality healthcare professionals. We want class-leading, groundbreaking education and scholarship, and I spend a lot of time encouraging my staff to go on training programs, putting them on master's programs. I've got some I put on PhDs, purely because I want to make sure that everything we do is right at the cutting edge of where it should be. And the only way I could do that is to make sure my staff are at the cutting edge of where things need to be. So I'm doing a lot of support and training for those individuals so that when they're in front of the students, they're using modern teaching methods. I've also been brought in to turn this into a research school because beforehand we were predominantly teaching and I'm a health services researcher. And so we also want to do things, you know, for society which are based on good quality evidence. So improve the health and well-being of population in the UK and worldwide through science underpinned health services research, enterprise and engagement. And a couple of examples I'll give you. One of my colleagues is working with Leicester Tigers and Leicester City Football Club and a number of other rugby and football clubs across the country, physiotherapists, helping them to look at their tendons and stopping some of the injuries we see during the games by actually measuring the strength of them and make sure they're safe to play. We've got somebody, again, another physiotherapist working with the national lacrosse team, again, looking at the different exercise and techniques they do to prevent injury. Research my team do, we're looking at the moment at DNA testing to make sure you get the right medicines. New technologies already adopted in America and Australia, but actually you can take with a simple cheek swab, we can say whether this drug is the right drug for you, whether it's the right dose. And we know 3/4 of patients is the right drug generally and it is the right dose. 1/4 of patients is generally not. And with DNA testing, which doesn't cost anything anymore like it used to, we can now say for that other quarter, actually you should have a higher dose, a low dose, or this drug's going to cause side effects. And all of those things improve the health and well-being of the population. But for me, We don't get any of that unless I've got happy staff. So it's all about creating a supportive and innovative working environment that retains and attracts leading and inspirational academic educators and researchers. Now, I remember my students saying to me, you know, my old university, we like the inspirational lectures. We like the people who say to us, you know, we look at and say, I want to be you in a later day. And that's the only way I can do that is by having staff that are happy, motivated, and well trained and well educated. So let's talk through the different programs. So physiotherapy is one of the programs that's been here quite a long time. It initially started in Coventry, but started here about 7 years ago at Leicester. And what's nice about physiotherapy, most of the staff are still in practice. They still see patients. They're really current in what they do. We've got our own teaching facilities. They've got their own space. It's almost their own building in many respects. And you'll see in the picture, this is one of the rooms where the students learn, and they have to practice on each other. But you know, they spend a lot of time learning all the manipulation skills that you need as a physiotherapist. They wanted me to tell you they have access to the dissection room, which we have on campus. There's not many universities have a dissection room anymore, so you can go and see cadavers and cut them up and look at them. As a pharmacist, I can think of nothing worse for me to do. That's why I am a pharmacist. I like medicines. I don't like human bodies. But my physiotherapists see that as a selling point for future therapy. You can go and see a body and see what it looks like from the inside. What's nice about all of my programs is the high level of student satisfaction. Students really enjoy their programs, make it very clear to the staff that it's about caring for the students, listening to the students, and you know, providing a high quality teaching experience. And we have a staff charter. One that we've set up recently has 10 points about the things we promise to do for our students. We've put everywhere, all over the school, so they're aware that we're working for them. Quite a big program. We've expanded that recently. It used to be 60, it's now 85 places. And even with the high number of places, good A-level grades are required. Operating department of practice, the profession that no one's ever heard of. That's how they describe themselves to me. And these are the individuals that when you go into theatre, they're not the surgeon. They're the people who will talk to you. They're the people who will make sure all the equipment's in the right place and it's all back where it was and not left in your body at the end of the operation. But they're the people who support everything that goes on in the theatre. And again, this is a far more practical program. Most of it is done in the workplace. Just about all theatres in East Midlands have our ODP students within them. Peterborough, Huntingdon, Leicester, up to Nottingham, Derby, down in Northampton and Kettering as well. Again, really does well on the student satisfaction. One of the top in the country, consistently one of the top in the country. We have 60 places, but slightly different. We have 30 in September and 30 in March. And this is one of the programs which we have an apprenticeship entry now for. So the March entry tends to be apprenticeships, and they tend to be ones where they get a salary and they're paid for by the hospital. But again, we're still looking for A-level qualifications to come in via that route. Midwifery for Leadership. This was the first ever course of this nature. You'll probably see in the news, there's been a number of issues with midwifery as a profession and its leadership. And recognizing that we need better leaders within the profession, the colleagues set up this program 5 years ago to prepare nurses, prepare midwives for those roles in the future. Nursing and midwifery are both 50-50, 50% in practice, 50% at the university. Again, they want to highlight the fact we have a dissection suite, but we also have a simulation suite as well. We have some ward beds and we have some sim man or dummies, which you can go and practice on that actually interact and change as you do different things to them. We get the students involved with antenatal classes and infant feeding on the campus to give them that practical experience of working with patients. And again, not the biggest program because again, there's only a limited number of midwifery training places in the region, but we have 45 places. And because it's a master's program, we've set a high bar for midwifery. It's ABB, which I think you'll find is pretty high compared to many other midwifery programs. And then nursing is the same, set up at the same time, again with the leadership within it, but slightly different. We have nursing dual field, which is mental health and children, mental health and adults, or children and adults. So there's a whole range of different permutations you can do within the nursing. But when you come out, that means you can work within 2 fields rather than 1. And that's partly why it's 4 years rather than 3. And then alongside those 3, we have an adult nursing training path as well. And that's the program I'm slowly expanding. It's 70 at the moment, but I'll be getting that up to 100 students intake over the next 2 or 3 years. But one of the things I've said in the school, which is quite important, is that we're not going to have ever more than 100 cohort. Once you go past 100 cohort, I know myself from my previous experience in my previous 2 universities, you go past 100, you don't know the students anymore. They become a number rather than a name and an individual. So the way the school healthcare works is we have all these different programs, all relatively small, but together very big. And that means then we can provide that personal service, we can get to know our students, we can support them, but equally it gives me that overarching infrastructure for research. Whereas if I tried to do the research just within nursing, for instance, I'd need 300 students to give me the extra income to allow to do the research as well. But by having 5 or 6 100 size courses, I can do the research and we can work together. And the research in health is pretty ubiquitous. It goes across all the different subjects. You don't need just nursing research or pharmacy research. We can all support each other. Again, for nursing, high level grades requirement, BBB. Program that started this year, incredibly popular. We have 30 places, 600 applicants, I think, this year for those 30 places. So people want to do radiography, and that's why we need, I'm sorry, I know, I wish I could do more. It's what limits the numbers is there's training places in the trusts. You know, how many radiography rooms do we have? And they can only have so many students following around when they're actually caring for patients and providing services. So, I do want to build that up, but at the moment it's 30. It'll be 30 for a few years until we start to expand. And I think the shortage of staff within the NHS that we're seeing and is still in place isn't helping that at all as well with those placements. We built our own simulation facility in the trust. They had a room that was a storeroom. They had 4 radiography suites, and then one of the room they'd not got a use for, exactly the same as the others, and they just turned it into a dumping site. We managed to get some money from Health Education England to turn it into a simulation suite. So they've now got 5 rooms, all identical, and our students can provide proper patient services under the supervision of our staff within this room, which is the University of Leicester's. And then I have to say, I slept well at the weekend. It's quite difficult. It's a bit like when you have an Ofsted visit, I guess. It's having the regulator come in and sit you there and put you through hell. And then at the end of the 2 days, we get told the result. I don't think that always happens in Ofsted. I think you might get it somewhere down the line. But after those 2 days, as I said, we've now got permission to take students. And what we're doing different for pharmacy compared to the rest of the country is we're putting big placements into the degree. So most pharmacy degrees have small placements, 4 years, largely simulation based, largely laboratory classes, and then they go out and do a 1 year in practice. There's 5 years to be a pharmacist, but in that final year, they have to do everything and learn everything because they've learned all the theory in the first 4 years. What I'm doing and what the government has said, they want pharmacists to prescribe now. So they want pharmacists who come out into practice with a prescribing qualification. They're not going to be able to diagnose and treat every condition like a doctor. It's more about being able to manage people's medicines once they've had the diagnosis and support them after diagnosis is what the government wants. And what they're trying to do is try and put everything into that year. So that year that taught them to be a pharmacist and taught them how to work in different environments, they're now teaching them to prescribe as well. So I've come to Leicester and said, right, let's have that year where they learn to be a pharmacist in the degree. And then the year at the end is where they learn to prescribe. And then they can learn to be patient focused. So we've got 13-week placements, which is the minimum size placement to be really effective, apparently educationally, in year 1, 2, and 3. And we've worked with all the employers, all the hospitals in the region, but I've also got very close links with Boots, Tesco's and Day Lewis, 3 very big community pharmacy companies who are offering us placements across the country. So plenty of placements in Leicestershire if students want, but if they come from anywhere else in the country as well, they can say, I want to go home for 13 weeks. They can do that. We can find them a place where anywhere. If I want to go for Cornwall for 13 weeks, there'll be lots of people with open arms. There's a real shortage of pharmacists and every other healthcare professional in Cornwall. So if the students want a holiday, we can facilitate that as well as part of their training. As I said, 30 placements this year. If it goes well, 60 places next year. And if I get my way, it'll be 90 places within 3 years' time for pharmacy. I will get it because I have all the placements across the country that I can offer. And that I'm not held back in pharmacy in the way I am with the other professions. So that's the sell. Sorry, that's taken longer than it should have done, but I had to get that bit over. So let's talk about why we select. And there's a few things here you probably may not have thought about, and the students probably don't as well. They think the selection's about choosing them. My experience tells us it's an opportunity to promote the university. So we bring them onto campus so they can see our facilities, meet our staff, so we can sell ourselves. So one thing to say to them is as much about the university selling to you as about you selling to them. And that should take a bit of the pressure off them. And when they're there, they need to be looking at the staff, look how they interact, look at the facilities. But it's not about facilities at university. It's about the individuals. It's the people who are going to teach you and the environment and the culture you're going into that's important. It's also the campus and the social life and all the other things you want as a student as well. So they get a chance to see the campus and facilities when they come on for interviews very often. They get to meet the staff. They get to talk to the students, and they're the people who give the honest view as to what the program's like and whether you should come here. And, you know, we can, whilst they're here, we can also talk to the parents and provide support and advice to them as well. And then the last purpose is to select the best students. And what I would say is, if someone's invited for interview, in my world, we shouldn't really be rejecting many at that point. They're going to get the right grades. They show they've got the right intellectual ability. So the selection process is just, for me, selecting out those people who aren't going to show the attitudes and the values that I want for an effective learner in this workplace. And then we'll come to that as we go through. So we were all told, healthcare professions, a few years ago, that we had to select students on NHS values. So that's why we have to bring in the students, and we have to do, or we do it online if we as well. But basically, we have to do a selection process because the NHS said we won't allow them to come and do placement with us unless you've reassured us that they've got the right values in the first place. So you can just type in NHS values into Google and this will come up and you'll find this very easily. But these are what they are: working together for patients, team working, basically, respect and dignity, commitment to quality and care, and I would see that as a student commitment to quality, compassion, caring, improving lives, and counting everybody the same, treating everybody, you know, equally without any sort of differentiation. And our selection processes are therefore designed to capture some of these. We can't capture all of them, and I think expecting an 18 or 19-year-old to demonstrate all these is kind of harsh in many respects, and that's why I think, you know, we should only be rejecting those who really don't demonstrate any desire to demonstrate any of those or some of those values. Are we okay so far? Yep, good. So when I did this talk last year, and I'm sorry if you were here last year, it's the same talk, but somebody says, my God, you're going to do all those things to the students before they say, no. What I'm showing you here, and I'm going to tell you now, is all the different things that could be done, of which generally there's 1, 2, or 3 of them. So I'm going to go through all the processes. Every program, and even all my programs, have different approaches. I don't make them all do the same. They decide themselves, but some of them do one thing, some do 2, some do 3, but nobody does all of them. Okay, so but the point is, wherever you go, they'll be using some of these techniques as part of their selection process. The first thing is personal statements. We shouldn't, strictly speaking, be using personal statements in any meaningful way anymore in universities. The reason for that is because they preference those students from the least deprived backgrounds, people who get the opportunities to go and do the Duke of Edinburgh Gold and do all these other things because their parents can take them and have the resources to do that. Their personal statements are far more stronger than those individuals where they don't have the resource and they don't have the access to those. So we've been told, and I know medicine don't do it, and my pharmacy program won't, and my other programs do, not to use the personal statement for grading people because they've done all of these wonderful additional things, because that then immediately disadvantages people from less well-off backgrounds. Okay, but one of my teams still uses them purely to ensure the student knows about the profession and they're enthusiastic about the profession themselves. I think if that's all they're doing, again, it does cause some differentiation because students from a better school will have had better guidance and support and told what to write in their personal statement than someone like me who didn't go to a school would give me any help. But God knows what I wrote, but it's complete rubbish when I was an 18-year-old because I had no idea what the universities were looking for. But what we want to see is that they mention the profession. So if you apply for physiotherapy, you say, I want to do physiotherapy, because we know students hedge their bets. And so they sometimes choose 2 other subjects, and this is their 3rd or 2nd choice. So we want to know, with the University of Leicester, we want to know this is their 1st choice, not their 2nd choice. They need to show they've got some understanding of the profession. Work experience will help with that, but again, this is another reason why personal statements don't help, because those people whose parents are physios are from different backgrounds will have a greater access to that work experience than those that don't. But showing enthusiasm for the role by saying physios do this, this, and this really aligns with my interests and my strengths, that would be nice within a personal statement. What I think, though, the winner is, if you really want, is to show NHS value. So to go back to those and think of examples that you have done which demonstrate that you're caring and compassionate, that you're a team worker, that you understand the equality, diversity, and inclusion agenda, and you recognise about treating people equally, irrespective of backgrounds or protected characteristics. So personal statements, we all have to write them. If we're going to write them, just make it clear. So put the profession in, show you know what the professional role is. And pharmacy is a good example. People apply to pharmacy, they just talk about community pharmacy because that's the only person they see. When I can tell you now, pharmacists work in GP practices, thousands of them, and in hospitals, again, tens of thousands of them. So actually pharmacy is not just community pharmacy. There's all these clinical roles, all with prescribing that we already have now. And so if someone writes me a personal statement that just said, community pharmacy, it wouldn't show me they really understood the profession. But as I say, we don't look at personal statements. Well, I don't for pharmacy. None of my programs do apart from physiotherapy. They're the only ones that do. And they try and do it in such a way because they get so many applications and they can't interview everybody in such a way that they don't differentiate on people's backgrounds. Yeah. Oh, do they read? Oh, okay. All right, fine. For the same reason. Yes. Yes. Sorry, radiography is new. We were playing with different methods last year, and they did 400 interviews. Something stupid last year, and I think they've obviously changed their process to reduce that number down. But pharmacy, we're not, and we will never use personal statements. So we then have interviews. So some universities do group interviews. And this is obviously a much more efficient way to get lots of students in, assess them as a group. And within that, what you're looking at is whether people have got the confidence to speak up. So very easy, you get a group of 8 students, and if they all sit there quietly, you think, well, actually, I want the ones who are going to engage in the teaching sessions, ones who are going to be easier to work with. So they will be observing the other students. There'll be someone leading the process, but then somebody else observing and scoring each of them for how well they contribute. So if they're going to go into a group interview, say to them, don't sit there and be quiet. Don't shout and throw answers in just willy-nilly either, but make sure that you are seen to be part of it and seen to be contributing to it. They will sometimes give scenarios and things which create conflict and disagreement. And they may well be looking to see how well people manage conflict and how well they support each other or how well they build their arguments as well. And they may well give them something which involves a little bit of team working, and they can assess that as well through these interviews. It's not something I particularly like, group interviews, because I think I was an incredibly shy 18-year-old that couldn't see anybody in the eyes, and I just think it's a hard way of assessing people. But I know they're used, I know other places, but we don't do that at Leicester. Individual interviews, again, are subject to some biases, I guess, but we generally have service users with us. So we have people who are not healthcare professionals who will describe themselves as representatives of patients in the interviews with us very often, so that we get a balanced view of the students. And when I do interviews, it's always the patient or the service user whose views I take on board and decide whether I want to take that student or not. Because I think I'm an academic, I have a very different view of what I want. They'll have a much better idea of what they want to see in front of them when they're on the ward or when they're in a pharmacy or whatever. But what we do in the interview is looking for enthusiasm and understanding in the profession, knowledge of the subject itself, We very often look at their study skills and how they revise and how they prepare for exams. But actually, in an interview, you can test NHS values. So a question we ask is, give us an example of where you've demonstrated caring and compassion. And then the students have to come up with an answer to that. And that's a very easy thing to prepare for that will give us. And it doesn't have to be anything to do with being a healthcare professional, someone looking after a relative or dying dog or something, but something that just shows that they're a caring and compassionate individual. So interviews are fine, but they're quite labour intensive. So we do other things as well, which sometimes are a bit less labour intensive. This is probably the worst one of the lot, though, multiple mini interviews. The reason we do these is because they're more valid than face-to-face interviews. A single face-to-face interview is very much dependent on the person interviewing, puts the student under a lot of pressure, and they have to perform for quite a long time. Mini interviews have been designed where you have at least 7 stations for validity, and each student goes round and spends just 1 or 2 minutes at each station. But 7 different people get to view that student, and then it's the overarching view that decides whether they want to select them or not. So you might have 2 patients, you might have a couple of students, you might have a couple of staff. But basically the student goes in, they're asked 1, 2 questions, buzzer, next one, 1, 2. And then by all 7, at least 7 people seeing that student, they can then make a valid judgment as whether they demonstrate the NHS values. And all of them ask different questions. Very labour intensive. So when you've got hundreds of applications, this would kill us to do this. Medicine do this because medicine gets a lot more funding. I'm not bitter or anything, but gets phenomenally more funding for training medicine students than others. They get almost twice as much. And therefore they have the resources to do these sorts of things. And they are good, they are valid. It's a really good way of getting patients involved. It's a really good way of getting your students involved in the process as well. So just to remind ourselves of what those examples would be and what those questions may be asking. Working for patients. So again, in an interview, we can ask a team working example. Give me an example where you've worked with a team. And what students always do at this point, they give me an example of where they were a leader. They want to show you they led the team. And I'm not really interested in whether they're a leader. I'm interested in someone who's a good team worker. And you can be a good team worker without being a leader. So somewhere where they've actually contributed, they've communicated effectively, they've identified problems and spoken up, they've delivered on time, they've done their amount of work. All of those things will demonstrate good team working. But I think students all feel they need to show they're a leader. So respect and dignity, again, they can do that when they show they've cared for someone and how they've shown respect for them in the way they've dealt with them and how they've managed their dignity as well. Commitment to quality care is about them saying, well, actually, I realised I wasn't good at this, so I went away and did this to improve how I operate, or improved how I worked. Or I went on this training program, I went and did this badge or something. Anything where they've shown that they are committed to getting better at what they do and not just a passive learner. And it can be anything outside, it doesn't have to be academic at all. Compassion, supporting someone through a difficult time. They'll all be going out when you go back now, trying to find someone who's in trouble so they can go and help them. So they've got an example for their interviews when they come in. But, it's about preparing them and saying, just go away and think about this, because thinking about it on the spot, on the day, is very difficult. But if you said to them beforehand, just prepare 7 scenarios in your head, this will prepare you very well for the interviews that you're going into. Charitable activities, we all encourage this as much as we can. I know medicine does as well. But if they can do some charitable activities, whatever they are, even if it's just a fundraising event or a children in need event, something which shows they do things for others to improve the life of others, is a really nice way of demonstrating an NHS value. And everybody counts would be about doing something like for a disadvantaged community or someone that, doesn't normally get the support and all the support everybody else gets in society. So I just thought that was quite helpful halfway through, just to talk through the different sort of things you could think about. The thing I like doing best with the students, which is quite fun, is an activity. And this generally is about testing team working. And what you do, you get the students to do something in a small group of 4 minimum, and you give them a time and a stupid task, and then you don't care about whether they deliver the task at all. What you care about is how they work together on it. They don't know that though, or we don't tell them that. So there's one example I just remember, sticks in my mind, 5 students, One student, once they started, he sat there, put his legs on the table and let them get on with it. And he had obviously thought, well, they know what they're doing. They don't need my contribution. I can be a passenger in this, because actually what they're assessing is whether we have a good egg that'll fall 8 foot without breaking, because that's what I used to do, is give them an egg, give them a load of material, say, now create a cradle or something. So if you drop it from this window, it won't break on the floor. That person, I think, would be the worst kind of student to educate, because they were the one the other students come to me and complain about and say that they're not pulling their weight, they're making us do all the work, and that would not demonstrate the values of someone who's team working. So again, the useful thing for you to do is go and highlight to them is it's not the end point we're interested in. We don't care if the egg breaks. We don't care if it doesn't make it across the bridge you made. That's just for fun. What we care about is the journey you went on and how you work with your teams. I know it's only 10 minutes, but generally that 10 minutes is what we're watching. And again, we get student or service user and sometimes an academic, a couple of people watching all the students and scoring them, so that we've got a real non-academic view of that person's values and beliefs. Just to say why team working is important, not just for the NHS, but for us. Because of the size of cohorts, it's far more efficient to teach in groups than it is to teach as individuals. So very often, many workshops, many teaching sessions, problem-based learning, team-based learning will rely on students working in teams and making a fair contribution each to it, okay? So problem-based learning, you're in a group of 8, usually maximum, and what you have to do is break a problem down and go and work away on different bits yourself over 2 weeks, and then you come back and present the results as a team. Team-based learning, you work as a team in a session, in a workshop, to come up with some answers, a bit like the scenario here. But that way we can teach 30, 60, 120 students in one room effectively. They learn very well, but we are relying on them being team workers and team players. This is the one I think will test you now. This is what I'm now using in pharmacy. Situational judgment test. Now, these are what's used in medicine. I think, is it the CAT? Yeah, they do an assessment beforehand online, and it's based on giving them a situation and them deciding what would be their preference activity and what would be the last thing they would do online. And what these do is test their values. And they do a number of questions, and over the end of it, you get a feel for whether this person has high values or low values. What you can't do for these is revise for them and prepare for them. It really is, and that's why I think these are a really nice assessment. It really separates people out who really care and show compassion, and those who are more sort of self-interested and self-absorbed. So let's give you the example. You're aware one of your friends on the course is going out regularly before their placements and turning up at work on placements still under the influence of alcohol. Which one of the following would you do first in response? Do nothing, it's not your problem. It should be identified by their workplace tutor. Speak to the student and tell them they have to stop this behaviour now, otherwise you will have to report them to the university and the placement provider. Speak to them to discuss your concerns and ask if there's anything you can do to help them. Report your concerns to a senior member of staff in the workplace as you are concerned for patient safety. And speak to your academic advisor at the university for advice as to what you should do without naming the friend. So you can see there's probably one there that's real obvious not to do, but the others kind of you could argue for being sensible choices. And then it's a matter of deciding which one is the first, which is second, which is third, fourth, and fifth, and ranking them. And it's that ranking and then we used score, for instance. So I'll just share what I did. And this is my values here, and I might be totally wrong, so you're going to shout at me, but I'm not going to worry because it's my values. But what I've done is go through each of those answers and look to see whether they meet the NHS values, yes or no. And the one that demonstrates the most gets the highest points, and the one that demonstrates the least gets the lowest points. So if we look at the 0, point A, I think hopefully we agree, do nothing is not an ideal scenario. That doesn't demonstrate any values at all. The one we've said probably ticks all of them: teamwork, respect and dignity, commitment to quality care, compassion, everyone counts, is actually, when you look at it, the last one. Speak to someone secretly, get some advice, and then decide what the best approach is without naming them and without showing them. As your first step, because as a student, it's going to be difficult to make the right decision here, and therefore getting advice probably is the most sensible. But there's nothing wrong with, the third one, I think, which we've said, speak to them, discuss, and ask them you can do to help. That's showing care and compassion. The reason I've scored that slightly lower, I think, is that's not working for patients. That's focusing purely on the individual. It might be patients that are underwhelming that, underpinning that. But with the E answer, you're thinking about. I suppose you're thinking about everything, I guess, with that one. But yeah, so that's how it works. So they're not. You can't go and revise. You can't go and practice them. Yeah, but again, knowing what the NHS values are and knowing what's being looked for, is this caring and compassionate? Does this show respect and dignity? Is this treating everybody the same? Knowing those, you can then start to put them in some sort of sensible order. So, well, we're not done too bad. A bit of time for a few minutes, questions if we need be at the end. Not that I'll be able to answer them. So, to summarise, first thing I'd say is make sure your students know well about the profession. You don't need to, you can do that online nowadays. There are enough places will tell you all about the profession. Any course itself will spend many time selling the values of the profession and selling what the different roles are because they want you to apply for that. But the students, nowadays, I have to say they are very good. We've done a load of interviews recently, and I've got to say they really show that sort of level of preparation. But you still see the odd student who really is clueless and really hasn't done that work and has turned up and just think, well, I'm here. You're lucky I'm here. Why should I have done any work? You'll be lucky to get me. And I kind of value that the attitude towards that. Well, I don't want you, if that's the case. So they do need to read up on the profession, make sure where it's going, see what's going on. The other thing they do, which is interesting, they often turn up and tell me they've read a paper. And that was really, and I have to say that never really excites me, that answer, because I always think that's always really contrived and fixed. And I suppose sometimes it's nice, but really I just want them to understand the profession as a whole and what skills and requirements are and what it looks like. Enthusiasm is really important to us. I want students enthusiastic, not ones that are going to sit there and sit back and be passive. It's all about active learning if you want effective learning, and therefore we need people who are going to be enthusiastic about that. Team working, I think, is the one thing we all try and assess nowadays, so they really need to think about that. And again, when you're designing your teaching, possibly it might be worth thinking about getting some team working activities and then getting them to reflect on what a good team worker is and what one isn't, and thinking about that. And you may well do that anyway. But overall, it's about demonstrating humanism. Those values together are what make us a caring, compassionate, kind human being. And that's really what we're looking for with them. And then the last thing, and this is purely to tickle our egos. It's not really useful, but it is nice if a student says, oh, I know where you got in the NSS, or I know that your university is in the top 30 for research, or I know this about you. So just having a bit of insight about the university and why they're selecting them, telling us we're the biggest university or we're the best university, it's just blag. They're not telling us they know anything about the place whatsoever. So a little bit of work, because again, that does sometimes please the academics to know you know about us. But the last point, the point I made at the start, it's about them recognizing they're interviewing us as much as we're interviewing them. So we're going to do all this. Hopefully, if we're human ourselves, we will only reject a very small percentage. I kind of have a rule of less than 5% rejection at this phase. It's only those people like that student who didn't contribute to the team who I want to see rejected, or students who don't demonstrate any care or compassion. But when they're there, look around, see what they see. Don't be taken by the equipment and all the bits of gubbins, because that's just for show. And the best example, every school of pharmacy has a dispensary. I've built one here. Think about 100 students. How many can you get behind that counter? 1, 2, 3. As a teaching tool, it's fairly useless. It just shows the student what it is. They'll go in and practice a little bit in it, but it's not that's important. It's all the other things they do around. But we have those. It's like the front door of a care home. When you go for a care home, you have to go and choose one for a relative. If the entrance is beautiful and nice, worry. was my experience. I've worked in many care homes over many years, and that was always inversely proportional to the care behind. It was kind of a facade around. So what's important are the people, the culture, the attitudes, and what goes on behind the scenes. And that's what the students get a glimpse of when they come in for interviews and when they meet other students and speak to other students. Okay, thanks very much for listening. Any questions? Straight away, give him hell. If they're rejected, they can ask us for feedback. Absolutely, and we will get that. They never ask. It's a good question, actually. I've never been asked, not that I'm aware of, but I think if they were, and you know, that's why it's really important. We only reject if we're absolutely confident that they don't demonstrate and there's enough evidence to support that. Yeah. Yeah. Yeah.
And you've got 100 spaces and 600 applicants. Match that work out. How do we do it?
Well, you raise the A-level grades. So you've got 600 applicants, but you just keep moving your A-levels and your GCSE requirements until you get the number you want to interview. So that's what we've done with some of our programs. So with pharmacy, we've had 200 applicants for 30 students. We've rejected 90. We've got 110. We'll interview, about 90 will turn up for interview. We know we need to offer 90 to get 30 places full, because it's a rule of thirds, basically. I'm not sure if we should be saying this, but basically you have to offer 3 times more places than you've got to offer. So if I've got 90 physio places, I need to offer 270. So I need to interview 270. So even though I've got 700 applications, I set the A-level bar and choose it. What we do though, you're absolutely right. Because of that concern, we can have what's called a gathered field. So the ones that do really well, we offer straight away. The ones that are borderline, and on our ranking system we've used, haven't done quite so well. They're passed, but not quite so well. We hold them in reserve until the last moment, and then we make them an offer if we have to. It's tough, but you know, there is a balance, because once we made an offer, if you get the A-level, we have to take you. And if I haven't got enough places, I'm in trouble, because I'm going to break my contract with the student. So your question's spot on, but we do lots of things to think about this. Yeah. What we don't do is what we do in pharmacy. We opened 3 weeks before the end of UCAS to say, anybody want to come and do pharmacy at Leicester? As it happened, 200 people did. I don't know how we managed that, but we should be okay. Absolutely fine. Yeah. You're probably absolutely right. We probably are. But what we're trying to set up is apprenticeships. So this is one of the things I want to bring in across my programs, because apprenticeships attract people. One, they have different entrance requirements, so you don't worry so much about the A-levels. It's more about personal experience and having worked in the hospital and such like. And so we attract people from different backgrounds. But apprenticeships allow people to earn salary, don't end up with university fees because the fees are paid for. So they end up with a big debt at the end, £45,000 I read in the paper yesterday. So you attract a different rate, but there has to be some selection process. And, you know, Leicester puts itself in the top 30. And so, yeah, but you know, there'll be hundreds of people, like thousands out there who make really good nurses that we just can't take. Yeah. And it's also some masters. And I think part of the fact that we offer masters means they've got to be able to go on and do that extra thing, which may not mean they're a good nurse at all, maybe quite the opposite. I completely agree. Pardon? No, we're humans. I mean, you're absolutely right. And that's why, you know, some students we've had, straight A students, we reject in this process, because at this stage, they're not demonstrating the team working, they're not showing the care and compassion, they are just interested in their books. And we have to hold to that line. So even though they think, oh, I've got someone 3 A-levels at A, they're not going to make it as a healthcare professional. It's quite rough and ready. It's not a beautiful system, but we have to have some way of doing it. Yes.
If we don't have the normal competency-based interview scoring, so 1 to 5.
Yes. Yes. So they will also, we generally score, it'll be a rank that you'll give them, and there'll be a criteria against each of them as to where they're at and what a fail is and what's not. Pardon?
Just carry on doing.
Yes, absolutely, yes, yeah. Because, I mean, you saw the question, you know, give me an example where you were carrying compassion. That fits exactly that. Give an example where you worked effectively in a team. They're competency-based questions based on it. And actually, you're absolutely right. I do score out of 5 to each of those criteria. But as I say, it's the service user score I take on board, because I think they've got a much better insight as to what they think's caring and compassion than possibly I have, who's not seen the patient properly now for 8 years. Anything else?
Advice puts so much love.
I know. Well, some universities do, but you know, the training I've been on has told me that they're not ideal for the reasons I said, and because they advantage people from different backgrounds over others, and therefore they're not ideal. So I've kind of trying to ban them in my school so that we don't do that, because I want to have an inclusive environment which doesn't disadvantage anyone. But other universities, I'm sure, still do and still use them. So don't tell your students not to take them seriously. But what I've said to you is the things I want to see, and if they're going to use them, it's about showing the NHS values, show you know the profession, show you have an enthusiasm for the profession.
I can only give those really good examples. So please don't think your work is wasted. It might not be read as a document, but for that student, that process is absolutely invaluable. And we would tell them to take it as seriously as if we were scoring them on what they've written down, because it is so important.
The other thing to say, which I didn't say, I'm talking about for selection purposes, in my old interviews, my old place, and I still do here, you might look at them and say, oh, you're from, or you like this. At the start of the interview, you're not scoring it, but you're breaking down the barriers and relax them interview and show you're interested in them as a human being, as an individual. And you can only get that from the personal statement. So I very often read the personal statement because they've already got to the interview. It's not making a selection at that point, but it helps me then do a personalized interview. Or you've worked in a community pharmacy, or you've done this. And there's no scoring, no criteria. It's just about building that rapport, breaking the barriers down. And you get those students who are really shy and really nervous. And the trick of an interviewer is to get them so that they're before you actually start asking the difficult questions, they feel they're with you and they can do that with confidence. Yes. But yeah, just I don't like to select on them particularly. Is that okay? Thank you very much. I was in a 3-hour meeting today, and this got me out for an hour, so I thank you for being here. It's great. Cheers. All right. Nothing too contentious in there, was there?
Use the name of my work. I'm not very sure.
Yeah.
Everything like that. Was that actually part of the interview?
Yes.
Yeah.
Yeah. It's a nice thing. They like doing it. It's quite fun, and the bit at the end where yeah. But it is. But you're watching how they work as a team. But they think you're interested in the end point.
Yeah.
They think that's what you're scoring, which you're not at all.
No. Thanks for doing it.
It's all right. Okay. Thank you. All right.
Those are really nice to see some medicine alternatives and what
Mention. Yeah. No, it's fine. I mean, yeah, no.
that, and they just
No. They need to go and see what a doctor does, and they realise that may not be the right job. And then, thank you. Good. Thank you. Cheers. Right. I better go back to that meeting now. Oh, I don't want to be walking on that one.
service users. How are they selected and how do they take part in those?
Oh, we have a group at the university.
Okay.
I don't know how they put them, how they get them. Yeah, no, you probably search it, you'll find, but we have you can actually just apply to go on and we pay them.
Yeah.
Don't do it for free. But we're always struggling to get enough people and more importantly, get diverse.
Yeah.
Because most of our service users are retired, a certain age group, because they're, but we have about 90, I think, at the college. And then we select them.
Fully.
Yeah, but what I didn't say was in the interviews, we try and make sure that we have always two people of different ethnicities
Okay.
in our panel. So the service units, different ethnicity to the academic.
Yeah.
And then therefore you've got a more rounded view as well, which is better for the students. They don't think they're coming into a white dominated university.
It's really interesting.
Yeah, so they pay quite well. Not national minimum.
Your time.
That's all right.
Yeah,
Cheers.
appreciated. Yeah. Good idea about things.
Yeah, right, I'm ready to go back to this.
Enjoy.
Upstairs again.
Yeah, of course. Can you give me a favour? You go and taxi into the first floor, into the register 3, you get. Yeah, but don't be proud of
This is the very beginning thing. I think that my kids love that. I'm sure you want to. Amazing.
All right, ladies.